Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about Friedreich's Ataxia Global Patient Registry. Patients can accelerate the drug development and treatment process by registering for the Friedreich's Ataxia Global Patient Registry. Being part of the registry is a great opportunity to keep updated on what is happening and to possibly participate in clinical trials. It is very important that all FA patients are represented in the patient registry. This information was taken from FARA Australia with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about why is a patient registry vital to advancing knowledge about FA. When pharmaceutical companies begin the journey of developing a drug for FA, one of the first questions asked is, where are FA patients located around the world? The answer to this question is important because pharmaceutical companies want to know where patients are located when they plan for clinical trials. They also need this information for eventual drug distribution, so they are aware of the regulatory processes in each country where patients are treated. Pharmaceutical companies will need to plan for physician education about drug availability in any country where FA patients are being diagnosed and treated. There are an estimated 15,000 individuals affected with FA worldwide. Currently, the registry includes only 1/3 of all FA patients globally. The registry provides a way to notify FA patients about upcoming clinical studies and trials and avoids delays in the drug development process. This information was taken from FARA Australia with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about what the patient registry doesn't do. Patient registry information is never used for fundraising. Patient registry information is not shared with researchers and pharmaceutical companies without appropriate protocol review. Data shared with researchers is anonymized. This information was taken from FARA Australia with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about what causes the symptoms of FA. The protein associated with FA, called frataxin, is made by the FXN gene and is required for proper functioning of the energy-producing units of cells called mitochondria. When frataxin is deficient in mitochondria, tissues that depend on high energy, ATP, production, such as the nervous and cardiac systems, degenerate over time. Although FA is a systemic disease, brain development and cognitive functioning are preserved. This information was taken from FARA Australia with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about triple repeat disorder. FA is known as a triplet repeat disorder since it is caused by an expanded trinucleotide repeat. In those affected with FA, there are significantly more GAA repeats in the first intron of the FXN gene, see below. If repeat number exceeds 100, protein output is affected with an insufficient amount of the frataxin protein made. Low frataxin protein levels lead to dysfunction in mitochondria, and the symptoms associated with FA often, more severe symptoms and earlier age of onset are seen as the number of repeats increases. Alternatively, a point mutation in the FXN gene can also reduce the amount of frataxin that is produced. This information was taken from FARA Australia with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about patient-reported impact of symptoms in Friedreich ataxia. The aim of this study was to determine the prevalence and relative importance of symptoms experienced by children and adults with Friedreich's ataxia, FA, and to identify factors associated with a higher burden of disease. The authors conducted qualitative interviews with individuals with FA and caregivers of pediatric individuals with FA to identify potential symptoms of importance to those living with FA. They subsequently performed a cross-sectional study to assess which symptoms have the highest prevalence and importance in FA and to determine which factors are associated with a higher burden of disease. 39 participants provided 2,527 quotes regarding the symptomatic burden of FA. 202 individuals, 153 with FA and 49 caregivers, participated in a subsequent cross-sectional study. Individuals with FA and caregivers identified impaired coordination, limitations with mobility and walking, inability to do activities, fatigue, and lower extremity weakness as the most prevalent and life-altering symptomatic themes in FA. Muscle stiffness and functional staging for ataxia were associated with the prevalence of symptomatic themes in FA. In addition, the length of the smaller GAA expansion and the mean length of both GAA expansions were strongly associated with the onset of symptoms in FA. There are a wide variety of symptoms that affect the lives of individuals with FA. These symptoms, many under-recognized, have different levels of importance and occur at different rates in the FA population. The most common and life-altering of these symptoms represent potential targets for future therapeutic interventions. The link to this study is given in description. This information was taken from FARA Australia with their permission. Their link is provided in description.